What a shame to get to your 50s when you are at theoretically the height of your powers. Now you have more time because the kids are gone. You have more wisdom. You have more financial resources to not then be able to go and then really enjoy life for the next 25, 30, 40 years. What a crime that would be. And our mission is to add 20 good years of living to our clients' lives, because if we do that, we have a huge impact on society, because the 20 years that we add that are good years, when people are at the height of their powers, they are more wise, they are more connected, they have more resources. And so if you can energetically lean into it, take care of yourself, get healthy, then get the people in your life that are important to you healthy as well.
Welcome to the Optimized Woman, where we explore the future of health and longevity and what it really means to live life on our own terms. I'm your host, Orshi McNaughton, and I talk with experts and innovators pushing the boundaries of what is possible today so you can turn these insights into your own health transformation. Together, we are here to unleash the unstoppable force you're meant to be. So if you're ready to own it, start thriving again, and live the life you deserve, then let's get to it. Hey friends, today I'm joined by Jim Donnelly, founder and CEO of Humanot Health, a new precision health franchise created to make advanced health optimization accessible to more people. Jim is a serial entrepreneur that had built several successful ventures in the wellness space, including Restore Hyper Wellness, and now he's applying that same passion for innovation to the future of healthcare. In this episode, we talk about how AI and data-driven diagnostics are transforming longevity medicine and how new regenerative innovations like therapeutic plasma exchange are redefining what's possible for prevention, cellular repair, and extending out health span. So if you've ever wondered what's really next for personalized preventative medicine, this is a conversation you don't want to miss. So let's dive right in.
Always in shape, always in the gym, always taking on crazy adventures. My friends would make fun of me. Oh, hey, I'm going to live on an island in Panama for 7 days and just survive. That was always part of my dynamic. Then what inevitably happens to even the most fit people, you get married, you have kids, your joints start to hurt, your old injuries come back to haunt you. That's where I was about 10 years ago when I started Restore. I was in my mid 40s and things hurt. Things didn't work the same way. I was really eager to lean into that. I'm married to a woman who's a West Point grad. People hear that and immediately want to talk about her and West Point and all that. And she was a high level athlete. She ran track there, and she was now a mother of two. We had kids that were running around the world, and the amount of time you put into yourself and all the stuff that goes into it, it was very different. So that was all happening when I started Restore. It was all happenstance. I was meeting my wife for lunch, and somebody walked by her and said, "Hey, I'm going to do cryotherapy." I perked up and I was like, "What is that? I've never heard of that." She told me, "You go freeze yourself and blah, blah, blah." I said, "That sounds awesome. Let's do that instead of lunch." It is the lesson of entrepreneurship. You've got to be open to something new, because if I hadn't been open to something new, nothing would have come of it. But that really inspired me because I loved how it made me feel, but I hated everything else about the experience. I hated the clinic. I hated the owner. I hated the pricing. I hated that it was just cryotherapy. And I was open. It hit me at the perfect time in life. And I think there's a little serendipity involved with things like startups. There was some serendipity in it. And we had just taken this huge investment from a private equity group. There's nothing bad I would ever say about General Atlantic, but once they put that money in, it changed everything. It changed everything about how we had to think about the company, run the company. And to be quite frank, after 8 years, I was past it. I like to create new things. They wanted to optimize. The good news is we could come to the table and come up with a plan that allowed me to go to the next level and do Humanot, and allowed them to put some things in place and do Restore. So that was serendipitous. But what had also happened at the time is my dad had just died of cancer. And yeah, super close to my dad. And my dad did not live a healthy life. He was always overweight. He didn't really exercise. It wasn't that it was unpredictable that he died of cancer, But the thing I think I could have helped him with if I had human at the time is we would have caught it sooner. And the only deal with cancer is the sooner you catch it, the better your chances. So instead of stage three, we might have caught it in stage one. As much as I loved Restore, I just knew Restore would never go far enough. It wasn't saving people from cancer with early detection. It wasn't going to be able to embrace these higher level medical interventions. So I clearly had to do something new. I also got run over by a drunk driver around that time. I'm going 65 through a green light, they're going 65 through a red light, and that's never good for a human organism. And I was pretty crushed. My wife tells me, don't be overly dramatic, but as I almost died, went to the trauma center and was pretty crushed. Thankfully, I had a big truck. Thankfully, I was in pretty good shape, so I bounced back from that. But for a year, I was miserable. My neck, my shoulders, my chest were all damaged pretty severely. Stem cells brought me back. It really brought me back to not only where I was, I think it even took me back to pre-accident, made me feel better. I was just really intrigued by, wow, this regenerative medicine thing is huge and no one's doing it. What an opportunity. So between the cancer and all the stuff I wanted to do there, the regenerative medicine, being ready to move on from Restore, it set the table. The last thing I'll say is that I am a flawed human being. I love good food. I love desserts. I love sugar. I'm 20 pounds heavier than I'd like to be. And so I say to people, that does make me understand the issue. Like, you have to find people's why. You have to make it important to them. You've got to make it so that every day you feel something and you improve on a regular basis. Because if you don't do that, it's really hard to keep people focused and on it. And I say to my team all the time, my team will literally walk up to me, the marketing, one of the guys on the market, he'll pat me on the belly. And he'll be, come on, dude, it's about time. And if you saw me in person, I am in really good shape. I'm 18% body fat, a little high, but not too bad. My markers are good. They hold me to a standard as the CEO of Humanot. You've got to be better. You've got to be the leader. And they're 100% right. And so I have committed in the last 3 months. I've lost 10 pounds. I got another 10, 15 to go. I'm living the same thing that our customers and our clients and our members are living. If you can't find the why, and if you can't give them the right plan, if you can't involve them and give them agency, if you can't make it fun, if you can't make the progress obvious day by day, you're not going to achieve great results. And hopefully later we'll talk a little bit about some of the results we're getting, but the results are incredible.
That is such an amazing journey. I want to bring us back to Restore for a moment before we dive into Humanot. So the first step was really the cryotherapy. That seems was the spark to focus on recovery. Then later you added all these cool modalities of biohacking. I feel like you were really at the cutting edge when you started Restore Hyper Wellness, because I don't know anybody that were in a bigger scale was doing this. And then you
Yeah.
also ended up growing this franchise into 200 plus locations, which is
Yeah.
absolutely amazing. And obviously, this is before some of the other players came into the space. These biohacking centers
Yeah.
are now opening up. You were one of the biggest visionaries in this space that foresaw this niche was blowing up. I
Yeah.
think that is really huge because you took a big risk. In 2015, this was still very new, like 10 years
Yeah.
ago. So tell me a little bit about, okay, you learned about cryotherapy, but then you ended up bringing all these cool modalities and put them all together into this studio. How did you evolve this concept?
Yeah, there were a few things. First of all, we were looking to make big impact. And so if you're going to make big impact, we felt like we had to go beyond cryotherapy. Number two, we were trying to build a real business. I call cryotherapy a guy in sweatpants business. Anybody can throw a cryo chamber in a space. I literally saw a cryo place in the back of a boot store selling boots, cryotherapy chambers. By adding the other things we did, we're creating better impact, better outcomes. But it also meant that we were creating a real business. To have a real business, you've got to have some competitive barriers and enough complexity. It's not easy to replicate. At the time, we were absolutely ahead of the curve. There were lots of people doing one-off pieces of what we do at Restore, but nobody had brought it all under one roof. No one had put it under a brand that was cohesive and interesting. No one had created a real protocol around things and consistency and definitely no one had scaled it. And if you don't scale something, I think it's really hard to make it interesting. When you start to scale things, like we used to pay something like $9 an IV bag when we started. By the end, we were paying $1. And that all comes from scale. When COVID happened, all the little guys couldn't get IV bags to do IVs, but because Restore was doing as much as the big hospital systems, we had an allocation that protected us, so we never ran out of IV bags. There are just lots of things that went into it. I will say I'm an experimenter. Everything we did in the beginning was from my mind. Like, I think this would be a good ad. Over time, we got more sophisticated. We created what we called Restore Labs. We would test things, and people would send us everything. There isn't a device or something in the wellness space that someone hasn't approached me about and said, hey, this would be great at Restore. But once you get bigger and you have a franchise model, you have a limited amount of square feet, you got to have a process for deciding what you're going to bring in and what you're not going to bring in. And if you do bring something in, at some point you have to take something out. We got more sophisticated about that. But in the beginning, it was easy. It was obvious. Putting cryo with IVs, with hyperbaric oxygen therapy, with red light. These were all pretty obvious things. They were all clunky, by the way. The technology around each of those things, the aesthetic around hyperbaric chambers, the ability to do red light in so many different form factors, the ability to do cryotherapy without nitrogen anymore, where you can do it through electricity. It's come so far. I'm proud of the fact that we drove a lot of that. Like we at Restore made our own cryotherapy chambers. We designed them, we manufactured them in Poland. Our suppliers were more beautiful. I think they were more effective. I think they got colder. They were more reliable. And so everything we were doing was bringing the category along. You have to have a cohesive brand in this space. You have to follow the rules and understand regulatory requirements from state to state. You do actually have to have good equipment that doesn't break all the time. You do have to do it safely. You do have to put all these things together but still do it in a simple enough way for people to understand it. And you got to make it affordable for people. And I always say affordability is two things. It's money and time. And so just because something's cheap and it takes too much time that people aren't willing to give, it's not affordable. And so you got to figure out that dynamic as well.
What would you say the number one problem that you were solving with Restore Hyper Wellness? Was it recovery? How would you define that?
When we started, we thought it was going to be athlete driven. I would say that was the biggest surprise. Our business ended up being around 15 to 20% athletes in recovery. The much bigger piece of it was chronic conditions. So people had all of these, like 70% of the US population has some form of a chronic condition. It tends to be something that causes large amounts of inflammation. It's everything from fibromyalgia, rheumatoid arthritis. Those were the people that became the Restore customers. And they were all looking for something that didn't have all these bad unintended side effects. They were looking for something that over the long term wasn't destroying their liver, kidneys. They wanted something that they could feel better right away. We were blown away by how many people were impacted positively by something as simple as cold. The number of people that would say things like, you've changed my life with cryotherapy. Really visceral stories like, you saved my marriage. My husband couldn't walk around the lake with me anymore. He got to be a cranky old bastard. I was done with him. Then he started to go to Restore and do cryotherapy, and his knees didn't hurt. We started walking around the lake again and doing other stuff. Thank you, Jim. You saved my marriage. That was pretty powerful. We saw that again and again and again. And then all the other things that we layered on, we could get even better results. IVs, 70% of the population walks around severely dehydrated. Our food supply is so much worse in terms of quality than it was 20, 30, 50 years ago. So people aren't getting micronutrients. Hyperbaric oxygen therapy, red light therapy. I'll admit I was a little skeptical of some of these things at first. And fortunately, what they call a responder, I would try these things. I would be like, yeah, I feel it. I didn't let a lot of other people try it. They felt it too. And it's like, okay, this will work. Let's put it in locations.
That's how I found Restore myself quite a long time ago because I had my own journey with mold
Yeah.
exposure, just some chronic inflammation and health issues that I think a lot of men and women, but I focus on mostly women's health. But so many women in that 35 to 55 age range hit this all these health challenges where our stress resiliency go down. And while I
Yeah.
was somewhat of a workaholic and worked out all the time. It's really not the recovery that I
Yeah.
went for. I went there to be able to function, to have good brain function, good energy, to bring myself back to a level I was at before, that I was seeking to get back into being functional and a high performer. And that's what was driving me at the time, going into
Yeah.
the restore. That's how I ended up pivoting into the functional medicine nutrition space myself. I think a lot of people have that journey, initially
Yeah.
starting with the biohacking modalities and then start seeking answers. And they are not finding this in the traditional allopathic care system. So
Yeah, it was really interesting in that people would get results quickly and they'd also get multiple positive things happening at once. They might come in because their knee was sore, but then they would find that they also had more energy. They would also find that their skin started to look better because of the extra collagen production. These things stacked, and they're like, okay, once that happened, then they were willing to try the other stuff. I was skeptical about cryotherapy. It helped me with these things. What else do you have? And it was, you ought to try red light therapy. If you stack it, it's even better. And then, okay, I trust you. And then they would do it, and then it would be better. And so then they would say, what else do you have for me? It's pretty amazing. I tell people all the time, we're not anti-traditional medicine. There are lots of good things that come from traditional medicine, but we're also very attuned to the fact that there are other ways to get things done besides pharmaceuticals. I do believe some of that. But I also am a big believer in there are lots of things that if you put them together the right way, you get even better results. That's where we've evolved to at Humanot. It's take these obvious things and then layer on top of that other harder, more complex things. It's amazing the impact you can make on a person's life when you take that sort of functional approach and bring in all of the different parts of the toolkit.
yeah. And just one final question about this, and then we'll move on to talk about Humanod. But once you develop your format for your centers that are really beautiful, branded, you create this standardization across this sort of biohacking recovery modality that was really cutting edge. You had to educate every consumer that walked through the door because most
Yeah.
people never seen these things before. When did you realize that the franchise model was the right way to grow? And what were the biggest inflection points in that journey of going from one to 200 plus locations?
Yeah, we had success from day one. And as an experienced entrepreneur, you want to make sure the success isn't unique to that location. So we opened four more locations in places, but that felt different than our initial Austin locations. We put one in Round Rock, a suburb of Austin. We put one in a different part of Austin. We put one in Charlotte. We put one in my health clubs in Charlotte because I own the high-end health clubs there. And so we experimented and everything worked. No matter where we put them, all of the locations performed very similarly. Ironically, the location that performed the least was putting cryo in my health clubs. It's because you have a small captive audience there. And if you're not a member of the club, you won't come into the club for cryo if you're not already a member. We early on said, yes, let's make these standalone locations. They tend to work in all of these areas. Let's not be too clever. We would look for anchors. The idea was to put these in the fabric of people's lives next to nice grocery stores. Why? Because you got to go to the grocery store all the time. And so if you were going to make a restore successful, you had to create the mindset. This was something that you would do and again. So just putting them in nice centers by nice grocery stores seemed like a pretty obvious thing. So that became the roadmap. It worked pretty quickly. And then it was a question of, okay, we have something here. What is the best way to propagate this? I'd never done franchising before, but it just seemed obvious because you have a partner on the ground that wakes up every day thinking about how to make that business successful. Number two, you can scale incredibly quickly. Number three, you have partners that are iterating, especially in the beginning. Hey, what about this? What about this? So you're constantly improving. It's a perpetual improvement machine. Franchising feels a little bit used car salesman-y to us. How do you make it more sophisticated? So we did have constructs that I think were helpful. Like you had to have been an owner of a fitness boutique like an Orange Theory. You had to be a medical device rep at top companies like Stryker or Abbott or Medtronics. All of these constructs made sure we would have high quality franchisees to build the foundation around. So when you have those options, it becomes pretty clear that franchising is going to work for us.
So I want to start with the basic. How do you define longevity and health optimization within the Humanot model?
I start with a few principles. I say that if you're going to be healthy, you have to start with the foundational things. And that's movement, nutrition, sleep, stress, cognitive health. You could sprinkle in some community and connection, but if you're not addressing those things, you will not make great progress. So everything we do at Humanot around health optimization is making sure we're addressing those foundational things. So that's one principle. The second principle is that data is super important. There's objective data and subjective data. Subjective data is, are these things making you feel better? You got to be able to say yes to that or who cares? But then there's all the subjective data. We do 100 blood panels when you come in. We do up to 75 different bespoke diagnostics, full body scans, DEXA scans, movement diagnostics, gut health, brain health. We run you through these diagnostics. Then you've got to be able to process all that data. We have different tools that are AI enabled that allow us to create very personalized care plans. Personalization is super important. What we recommend are things that are going to solve your biggest problems first. Not only are they going to start to solve the biggest problems first, you're going to feel it right away. Similar to Restore, I'm a big believer at Humanot that you got to make people feel the improvement quickly, or they simply won't come back and keep doing it. Those are the ideas. And I sometimes hate to use the word longevity. I much prefer health optimization. I think for our business, we have to put longevity in the description, but health optimization is the real secret. And that is every day you're making people a little healthier, feel a little better so that they want to come back the next day and do it again. And then you put day after day together, that becomes week after week, month after month, year after year. That is important in the now, you're feeling better, and it is ultimately what longevity needs. That is the secret to longevity, whether it's lifespan or health span. It's all these things you do today. That's the secret to longevity. People ask me all the time, what do you think about the longevity space? I love the goals. I love the ambition. I think it's a little bit almost distasteful and creepy in some ways. It's rich people just at all costs seeking to live longer. There's a few problems with that. Number one, I want it to be available to many more people than just rich people. It should be democratized, something everyone in society can have. Number two, it's not this sort of very myopic view of just more years. It's got to be better living. And I think that if you're just focused on longevity and not really focused on the day-to-day better living, that there's a real problem with that. And I think that too many people jump straight to longevity is a bunch of interesting magic things like rapamycin and therapeutic plasma exchange. Those have a place. They're not where you start. They're the things you do as the last 1%, the last 5%. Therapeutic plasma exchange, for instance, if someone has a mold issue, if someone has a heavy metals issue and all that, it's absolutely a great place to start. But whatever it is, I want to start with the foundational stuff first before we get into the interventions that either cost a lot more or what I consider the 1% type things, the things at the end.
Yeah. You said a lot of things that I want to come back to, but I first want to talk about this space in general because I've been in the biohacking space, the
Yeah.
health optimization space, we can call it longevity or
Yeah.
health span space for a really long time. And it seems like so many things are coming online right now, but the space is becoming more fragmented from what I can
Yeah.
see. Biohacking franchises like Upgrade Labs, high-end longevity centers like Fountain Life, Next Health. Then you have a growing number of niche players like men's health clinics,
Yep.
IV, GLP-1, drip bars, telehealth, metabolic
Yeah.
clinics. And so with all that noise, how do you see Humanot distinguishing itself? What makes it different in terms of model, care, or positioning?
Yeah, so I think you hit the nail on the head in terms of how I'm going to answer the question. It's that there are very fragmented parts of the solution out there. And they're fragmented in a few ways. They're fragmented demographically, very elitist and only for the high end. I go back to Humanot, we're going to have membership levels and offerings at multiple levels, not just concierge medicine, not just a sort of entry level membership, but something for every different type of situation that you need. So I think it's fragmented in that way. I think it's also fragmented in that you have these specialists that do one piece of it. And once again, that can be okay. But I think the thing people struggle with was, okay, if I'm getting one piece of it solved, how do I navigate all the other pieces? And it's just really overwhelming for people. They don't know what to prioritize. And once again, I think Humanot's done a good job of saying, we're not going to be fragmented. We're going to do everything. We're going to address health holistically. We're going to address all the key parts of it. And we're going to be your one-stop shop and your co-pilot for all of the things that you need to do, rather than saying, hey, we do this, now go find someone else for all the other stuff. The third thing I will say is, and by the way, I caught a lot of flack for that in the beginning. The thing I heard from investors and partners the most in the beginning was, Jim, don't you think that's too complex? Like maybe you should just do regenerative medicine. And once again, I'd always come back to, if I do that, it won't work as well, because regenerative medicine works better when the rest of you is healthy. Hormones works better when the rest of you is healthy. Peptides work better when the rest of you are healthy. So I really felt strongly about that. The third thing that I have a strong conviction about with a lot of the players out there is that a omni-channel approach is essential. Telehealth is great. Telehealth is efficient. Telehealth can do a lot of things. It cannot get you as far as you need to go. There are times when you just absolutely have to be able to come into a clinic and have someone that can touch you, do an injection, do a diagnostic like a DEXA scan, shockwave, whatever it is. I just feel like telehealth cannot get you there without the in-clinic dynamic. And so those were three things that I make sure it works for people at different income levels. It's more accessible. I wanted to make sure we weren't just a piece of it. We were bringing it all together. And what we didn't do, we at least were a co-pilot for. And then third, I wanted to make sure we had an omni-channel approach. Many of them are going to fall in the telehealth thing. Many of them are going to fall into this super high-end only, like the Biographs of the world. Next Health is a clinic and it does a lot of things. I think of Next Health as like a fancy restore. It's a lot of the restore stuff with a little bit of medical on the top. Humanot is all the hardcore complex medical stuff with a little bit of wellness sprinkled in. We think about it differently. They also do a lot more aesthetics. And I think there are plenty of places to go for aesthetics. So I probably don't lean into that as much as we could. But no matter who you bring up, I could give you what's good about them, what we would do differently. And by the way, here's one thing I want to make sure. I don't talk bad about any of our competitors. Good for them. I want them to be successful. I think a rising tide raises all boats. I think that this category is huge and we're still at the beginning of it. And so it's much better for the category if you have lots of companies being successful as opposed to only a couple are successful and everyone else is failing. So there's plenty of room for everybody. I take no joy in hearing that a competitor is not doing well. I want lots of options for people and then they can self-select the one that's best for them.
Now, you mentioned multiple times that you are trying to democratize
Mhm.
access for people. Longevity medicine, health optimization medicine can be very expensive. It depends on the format of how it's delivered in more of a
Mhm.
concierge care format. How are you making it more affordable for the average person?
First of all, I want to make it clear that there are things everyone can do that don't cost money. Getting people to move better doesn't necessarily cost them any more money. Getting people to sleep better, getting people to put better food in their mouth. I would actually say a lot of times putting better food in your mouth can be cheaper. There are lots of things you can do, how you manage stress that don't cost money. So I think you got to have the philosophy of we're not going to only recommend things that cost money. We're going to recommend lots of other things as part of whatever we do. That'll take you a long way. Then you start to layer on lots of different options and at lots of different price points. We have things that cost $40. We have things that cost $10,000. We have things that cost $80,000. Obviously, a school teacher is probably not rolling in and doing an $80,000 treatment, but that's okay. What I hope will happen over time is that treatment that is inaccessible because of the cost over time will come down significantly in terms of price. By the way, how do you do that scale? So if Humanot can get much bigger and be 100 locations around the country and be touching millions of people, everything can be much more attainable, can be delivered much more cheaply. And those things go hand in hand. And also, I think it's changing mindsets. It goes back to what I mentioned about Restore, is when you do something for someone and it gets a good result, they trust you, and then you can recommend more things. And so I oftentimes have people come in and say, I can't possibly afford this. And then you lay it out for them and say, what's your job? I'll use an example of one of our very first customers. He was a fireman. He was like, I'm a fireman. Tell me about the rest of your life. I'm also very active. The problem is I now have a back problem that keeps me from being able to do my job and keeps me from being able to be active and do sports and all that. So I'm like, okay, stop right there. You have an existential issue. You literally have to solve that problem, or you cannot be the human being that you want to be or need to be to make a living. And okay, when you put it like that, how much are you willing to spend? And he was like, when I think about it like that, I could probably devote $5,000 to it. Okay, great. Here's what we can now do for $5,000. By the way, $5,000 is a lot. I get it. But if we can solve your back problem for $5,000, was that worth it? And the answer to him was absolutely. Now, if I'd said $50,000, and that's one of the reasons he came to us, he had looked at all the different stem cell clinics and they were inaccessible to him. But when he realized that we had an option for him that we could do for under $5,000, he was like, okay, I'm in. Now, he's got to trust that it's going to work. We got great results for him, and he sends me regular communications. Jim, once again, you changed my life. I never thought it was possible. I'm playing beach volleyball again. I'm crushing it. And I was like, all right, don't go too far. But yeah, it's changing mindsets. It's making it more accessible. It's creating scale. It's having lots of options. It's realizing that everything we recommend doesn't cost anything. Some things are free, and having the right balance. Now, we have people who fly in from all around the world, and they fly in on a private jet and they're like, hey, give me the best stuff. Okay, great. That's a different set of things that we'll give for them. I love those customers. They're great human beings. Some of them are doing some of the most wonderful things for other humans in their business life and in their philanthropic life. They're amazing. Having some things for them, I think, is a big part of what we do. Those things help us to afford the things that we can provide to someone who makes less money. Like that's like a little bit of a bridge to we can charge less for this because we charge more for this.
Yeah, I heard a little bit of what you said at Restore is that you created this new market and category in essence because that biohacking studio never existed before and you had to educate the market and you created that category in many ways. And I
Yeah,
feel like you are doing that now in the longevity optimization
yeah,
space. I think the biggest frustration in functional medicine is the confusion and lack of standardization
yeah,
across doctor to doctor, state to state. People get very frustrated because there's snake oil
yeah,
salesmen mixed with really great practitioners. There's everything out there. There are truly amazing doctors and practitioners offering life-changing options, but then there's also people mixing things in there that are
yeah,
not necessarily going to create good results and outcomes for patients. And like I see this, for example, in the women's hormonal optimization space, there's no standard. And literally, women are so frustrated, especially in this
yeah,
perimenopause, menopause age group, because women are now seeking hormone replacement therapy, but there's not really a standard of how to actually administer that the right
yeah,
way. If you go to your allopathic doctor, they're going to give you a certain set of options. If you go to a naturopath, going to give you certain options. You go to some online clinic that's going to give you some other options. And it's very frustrating because the outcomes are going to be different. Some just going to be suppressing symptoms, some actually going to help you optimize, two different ways of treating the same thing. And then again, hormone replacement therapy is just a small part of health
yeah,
optimization, but it needs to be
yeah,
part of your toolkit. If you can find a way to take all this complexity with different therapies and
yeah,
treatments and standardize it and then scale it into 100 clinics or 200 clinics, now you can bring down the cost and establish trust in this new category of healthcare
yeah,
that is going to be so amazing. And that's really what we need. So what's your perspective on that? Because that's what I'm
yeah.
seeing is like creating some standardization in this space is need it so badly. If you
Yeah.
can solve that problem, that's going to be amazing.
I'll start with a few things. You said biohacking and functional medicine. I'll throw primary care in there. Those are words that don't necessarily have to have a bad connotation, but to a lot of people, they do. Like biohacking is, oh, that's for the folks who are crazy and they'll push too far and all this. So we had a choice of saying at Restore, we're doing biohacking or we're doing something else. So at Restore, we chose hyper wellness. And we recognize that some of the stuff you do, freeze yourself, is a little out there. The word hyper made sense and people loved it. They loved the fact that, yeah, I'm pushing a little harder. But we got away from the word biohacking because biohacking had too much baggage. I would say functional medicine is another example of that. Like, depending on who you talk to, they think it's the greatest thing, or they think it's too woo, or they think there are no standards. So, once again, we do practice functional medicine and we're doing it at scale and we're changing it. But do we want to use that phrase or do we want to create a new category, i.e., health optimization? We thought that it was better to start with the category that we could control, define from day one, and that's health optimization. So then you get into all of the specifics and take female hormones, for instance. Hormones work better when you do the other things to make yourself healthy. A woman can start hormone therapy, but if she's not taking care of herself and she's not metabolically healthy, it will not work as well. I think number one, we have this approach of let's take care of all the foundational things, number one. Number two, we have one of the world's leading experts on hormone therapy, women's health, and sexual health, and all that, in Amy Killen. So I think it does matter like who you align with, the doctors that you have on your team. And what I say is wrong in this sort of medical world and the longevity world is that a lot of times a company will lean into either the medical side or the business side. If you lean too hard into the medical side, but don't have a great business side, you got a problem. If you lean too much into the business, but you don't have the right medical team, you have a problem. So I think Humanot has said we have to be a great business, but we have to have great medical practitioners who drive the way we improve health outcomes. We have the right balance and world-class people on both sides of that equation. In the business world, we're all very pedigreed, lots of success, great track record. On the medical side, I'm very proud of the way we put it together. And we have some nuance to the ways we do things. I'll give you one problem with hormone optimization, and I'll start from the male side. A guy walks in and says, I think I need testosterone. There are plenty of places that will immediately sign him up and never check his blood levels again. They'll just keep doing it. I would say there's some of that on the women's side, but here's the first thing we ask every man who comes to us asking about hormones. Where's your wife? Where's your partner? We don't want to fix you if we don't fix her. And we've now started asking that in reverse. Hey, where's your husband? Because we want to get you both fixed. Because we think of health as you and your ecosystem. And so it's just more complex than, hey, come in and if we put you on testosterone, you're fixed. No, that's just a small part of it. What are the other things? Women's hormones are super, super complex. There's all kinds of titrating and experimenting, and anybody that says they can get a woman's hormone levels perfect like that, they're insane. It's really hard. And I think there are many people in the health optimization, longevity, functional medicine space that have no business being there. They don't know what they're doing. They are way too cavalier about things. They think they're experts and they'll just fall on their sword. No, this is the way to do it. And it's, come on, man. You gotta have a little more humility there because you're one person. You don't have an ecosystem of support. Your tech stack is horrible. I could go on and on why some of the folks in this business have no business being in this business. But the cool thing is that when done well, with the right people, with the right tools, the health outcomes that we can see are amazing. I'll give you a couple examples. We have a ton of folks that come to us that are pre-diabetic. 100% of the people that come to us with issues around A1C and other markers for pre-diabetes, because they're in that range or about to be in that range, we improve. 86% of the pre-diabetic patients we see, we move from pre-diabetic to not pre-diabetic. More importantly, we do it in under 6 months compared to the industry standard of 1.5 to 2 years. That is an example, and I could give you examples on 15 other markers of real medical improvement. That doesn't just happen by chance. We have very specific ways that we do that. We have very specific protocols. We have very specific tools. We have lots of people in our ecosystem that have weighed in and said, let's do that better. We constantly improve. We constantly evaluate what can we do better. And I think that's how you ultimately practice good medicine.
Yeah, I totally agree that the biohacking word became a little bit radioactive or brings up a lot of red flags for people. I was in that space for many years. I still am in many ways. I hosted the Women's Biohacking Conference for 2 years in a row and interviewed over 100 people. Now my podcast is called The Optimized Woman because I want to be more in
I
that
love it.
health optimization space. I feel much better about calling it health optimization that doesn't have any stigma attached to it.
Yeah.
I completely agree with you. And also just the complexity of figuring out women's health and women's hormones. It is such a
Yeah.
complicated and humbling space. I'm a woman
It's,
in
yeah.
midlife that have gone through my own health journey and worked with a lot of people and still working every day to figure out my own optimization. It's not like a straight line. It's
Yeah.
like ups and downs, and you constantly have to adjust and figure out what you need. That sort of N equal one experimentation and personalization is so important. And it's amazing that you can deliver this in a format that is really looking at men and women in a holistic way, understanding that everything is connected to everything else in the body. It's lifestyle medicine, it's supplements, but it's also medications and the best
Yeah.
practices from allopathic medicine. And then it's early detection of potential diseases, like cancer being one of those things that you want to catch before it really starts or right in the beginning so you can easily treat it, not when it's too late. Early detection is so important. Understanding that we have so many
Yeah.
tools in our toolkit to have a doctor and a clinical team that can evaluate you that holistic way and give you, okay, this is like the most urgent things to address, but then maybe these are the things you want to do truly for a health span, looking at the
Yeah.
quality of your life and aging better. And then maybe even reversing certain injuries and things that just life have. We all had accidents and injuries and stress and exposure to environmental toxins and all kinds of things. By the time you are in your 50s, you have something you have to work on. And I think that's the story of most people. I think people just need to be educated about this new
Yeah.
category. I'm so excited that there's somebody who's taken on this beast, creating this and understanding this complexity and creating standardization around it, which is a very difficult task. I'm
But
really grateful that you and your team dove into this, including Amy Killen, who I also interviewed, who is definitely a rock star in this space.
part of the problem with the biohacking industry is people made it about them rather than making people better. Some of the rock stars in the biohacking space, to be quite frank, people look at them and go, I don't, that doesn't look good. That's not what I want to be. I'm very quick to say Humanot is not about Jim. I don't ever want to elevate me to the point that it's about me. It's about the business. That would be an incredible amount of pressure for it to be about me. All the clients we have, I'm living pretty well. I have a perfect life. I'm super happy with where I'm at physically and from a health perspective. But we're depending on me to be the standard bearer for everyone else. That's a lot of pressure. People got to pick where they want to be and all that. So I try to be a good role model and all that. Same with you. I look at you and say, this is someone I want to follow. If you're going to lean into talking about the optimized woman, women need to look at you and say, hey, I like it. I'm not just looking at all the things. I like the way she thinks. I like the life that she is now living. I like the way she's talking about health. It seems accessible. I just think things like that lost their way. And some of the guys like Brian Johnson, hey, good for him, all the things he's doing, but man, that looks weird. I don't want that. I'm not going to name some of the other names, but I would say the same thing about them. We give our clients some agency in that they come to us and they give us how they want to do it. A lot of times they'll say, I want to do it with no pharmaceuticals. Okay, great. We can work with that. It's different. We're going to do some different things, but we can 100% do it that way. Other people come to us and say, no, everything, whatever you want, throw it up. Great. That's a different way. I do think that involving the patient, meeting them where they're at, and giving them some say and what the approach is important. And I also use the word fun a lot. Like, you've got to make this engaging and fun. And we have lots of things that are launching over the next quarter or two that will bring some of that to life. If you don't, people do not stick with things that aren't fun. I'll put asterisks around fun. Like, it's not all fun, but at least it's engaging. You're involved, you're making choices, you're choosing it. There are moments of fun, moments of joy. Traditional medicine does everything they can to squeeze the joy out of everything, to squeeze the fun out of everything. Can you involve me, or are you just going to talk to me in a one-way direction? By the way, I know you don't know everything because most doctors don't. How are you telling me definitively this? My dad died of cancer. He went to the best place in the world, MD Anderson, and I'm grateful they kept him alive for 5 years. They didn't tell him one word about nutrition, exercise. This guy was on chemo for 5 years on and off, miserable, and they kept him alive. Not one word about nutrition at the best place for cancer in the world, arguably. I'm like, come on, man, there's a better way. If you looked at Restore back in the day, it didn't feel like a medical clinic. If you look at Humanot now, even more, we will, if we see something that looks too medically in the clinic, I will squeeze the shit out of that and get it out of there immediately. Which is not to say that our procedure rooms, of course, have to look like procedure rooms and we have all the equipment to do guided injections and things like that. But whenever we can, we want to make it beautiful because people appreciate beauty. We want to make it fun. The staff has to be engaging. If the staff isn't focused on you, that is not someone that's going to work for me for very long. Like I said, I think there's so much opportunity to make this a better dynamic for people, and you'll get better results.
So nowadays, AI is changing everything in the world. How do you see AI reshaping healthcare, and how are you bringing that into Humanot?
We spend millions of dollars on technology. We'll have spent over $10 million on things like our AI enablement. We're a big believer that these things have a place. And it's why we are so enthusiastic about what we're doing and know that we'll be one of the winners because it takes a lot of intellectual capability to process how best to use AI. It takes a lot of money to build the right tools. And I think everyone in the medical space will have AI tools. The degree to which you can integrate it into your own proprietary way of doing things and make it part of the presentation layer, how your clients interact with you, that's much harder than having a generic AI tool. The smaller players are going to have some generic AI tools that help with administrative tasks. The bigger players are going to have all those things in a much more integrated, thoughtful, unique, differentiated way. And we certainly fall in that second camp. But our thesis around AI is let's let AI do what it does well, and let's let humans do what they do well. Anything that we can pull out of the day-to-day experience of our doctors that's an administrative thing or an AI capable thing, let's get that over to AI. Booking appointments, ordering lab things, creating the initial care plan from all the data. There's lots of that. What do humans do? Humans take that and make sure it's right. Humans do a really good job of talking to people and interacting with people and making them feel good about it. I want my doctors and medical staff doing the human things, the things that provide that these people care about me, these people are paying attention to me, and I want the AI to do all the other stuff. AI will get better and better. There will come a day where AI is right next to the doctor making recommendations. We have some of that already, but I still think there are things that humans do uniquely. I say it all the time. The more AI becomes a part of our life, the more people will crave human interaction. Let AI do the AI stuff and let humans do the human stuff, and you'll have a much better offering. You can't be
Yeah.
afraid of it. I think people both underestimate and overestimate it. It's amazing what it can do. Good God, it's incredible. But I also think that for the folks running around thinking like, oh, it's better than doctors, it might be better than bad doctors. It's certainly not better than a great doctor like Dr. Navarro, who's our head of longevity, his ability to pull things together, process it, convey it to a patient, make them feel good about it, involve them. Yeah, he's not there. And I don't think it's going to be there soon. Also, there's going to be a lot of institutional friction. Like it'll be a while before AI can truly have the opportunity to replace a human doctor for all the right reasons.
I think the perfect model is what you described, to train your own model that
Yeah.
creates a moat for your
Yeah.
business. And at the same time, you still have the experts and the human
Yeah.
there to facilitate it. But just to mention something to our listeners, because if they've never worked in the medical space, people may not understand that doctors and healthcare professionals don't have the ability to digest so much data all at
Yeah.
once. So when you have a lot of diagnostic tools and labs and you need to aggregate and digest all that data, AI can do that very efficiently
Yeah.
compared to a human. So if you have tons of an MRI, full body scan, all these lab results, years of lab results, and we have years of charting notes and history and all this information we have to put together and then figure out the best strategy for you and customize it for you. We need AI to help us. For a doctor, it would take
Yeah.
hours and hours reviewing someone's file and try to understand it and connect all the dots. Whereas AI can almost do it instantaneously if you
Yeah.
have your own internal model trained on this. Efficiency and a higher level of care for people, because
100%.
now you can take all this amazing diagnostic testing and everything that you guys are going to be offering and really create the best model based on your own protocols and the things that you
Yeah.
standardize for your clinic, apply that, and then, of course, maybe give the Cliff Notes version for the doctor to review before that appointment with the patient. At least that's how I envision it. Is that sort
Yeah.
of a piece, or how do you see it?
Yeah, you're 100% right. We can take all of the data that we get from our diagnostics, and in a matter of seconds, we can kick out a care plan. Now, a lot of work went into that
Yeah.
because there are certain parts of that data, like blood panels from LabCorp. There's an API. It's actually really simple to pull that into your AI engine and your AI protocols. There are many other diagnostics we do. There are no APIs. There are no easy ways to get it into the system. So it's still clunky. So we've spent a ton of time creating ways to get hard to assimilate data into our recommendation engines and all that. So there's still a lot of work, but once you get it set up, AI has an amazing ability to process thousands of data points seconds. And so then it goes back to my previous one. Let AI do that, then let the doctor be the overlay on top of it. Okay, this all looks good. Now let me add my own professional sort of opinion on these things. But they can do that in a matter of minutes, whereas before it would take them an hour to prepare for that. And so do you want your doctor preparing for an hour when AI could set him up in a matter of seconds? No, you want him doing the things where he adds a ton more value. It's certainly not aggregating insights from thousands of data points.
Yeah.
So
And I'm assuming as you have more years under the belt of having these clinics and more patients treated, the AI model that you develop will also
gets
learn in
better.
advance and
Yeah.
figure out what's working, what's not working. You can have better outcomes as time goes by.
We're practicing at scale now, by the way. We are seeing many patients now, to your point, every day. Our systems get better, the care plans get better, all of that happens. And so that's why I say it is important to have the Humanauts of the world out there because when they get to scale, it's thousands of patients a day. And that data gets read and the outputs just get better. The other thing I'll say is that AI will catch these little outliers that a doctor, if he were going through all that data in an hour, might miss something. And so now, here's where I agree with the current practices that a doctor still needs to look at everything that AI kicks out and make sure it's right. AI is not ready to be unsupervised. AI should not be your doctor. AI is a tool that helps good doctors be better doctors. AI should not be your doctor. Many of the offerings out there in the world today, that is what is happening. AI is your doctor, and that should not In my opinion, that's not where we are yet or should be.
So, what are new therapies and technologies near term or things that may already be in your clinic that you're most excited about, or new tools
Yeah.
that you're rolling out in your clinics?
Yeah, so I'll answer that in two ways. Number one, there are some cool things. Like I'm a big fan of therapeutic plasma exchange. For folks who don't know what that is, you take the blood out of one arm, it goes through a blood dialysis machine. It separates your plasma from the rest of your blood. Your plasma is what holds all the heavy metals, microplastics, zombie and senescent cells, and inflammatory markers. So we essentially take that and it gets aggregated in this big bag. You throw that bag away. And that's all the bad stuff. I've seen it be everything from a dark brown to a light yellow. And the darker it is, the worse your blood was. And then you replace it with albumin, which is one of the big building blocks for plasma. So it's almost like an oil change. You take this ugly, bad oil out, you put this much prettier looking new oil in, and it's great. Theoretically pulls out heavy metals, microplastics, dead cells, and other things. Now, there's lots of debate about the best way to do it. You used to hear the young blood dynamic, and that was an early version of this called plasmapheresis, where you would take your blood and replace it with young blood. And people thought that it was the young blood that was doing all the benefit. The reality of it, it was getting the old blood out. That was where most of the benefit came from. Therapeutic plasma exchange has over time become the better approach to this. We rely on things like the Buck Institute to put these things through some rigor. We're not cutting edge, we're leading edge. We don't want to be the first to do things. We want to be early adopters for things that have some real substance behind them. But that's definitely one of my favorites. I also like the idea of reimagining some of the old favorites. I'm a huge fan of hyperbaric oxygen therapy, but I think that when you pair it with other things and you have specific protocols around how you do it, it works better. The magic is not just simply saying go do hyperbaric oxygen therapy. The magic is go do the Humanot protocol around hyperbaric oxygen therapy, because we do that and four other things with it to get better results. It's not always the new crazy thing. And some people look at therapeutic plasma and say, oh my gosh, you're going to literally take out all my plasma. But man, I tell you, it's pretty, and there's some unintended consequences of it from a positive perspective. Like we've seen it improve lipid panels, we've seen it improve all kinds of things. Now, the problem with it is, once again, it's relatively expensive. It's a little bit inaccessible for folks that would like to try it. And so my goal is to get to the point where we're doing 1,000 of those treatments a day, and I can make the price of it half of what it is today, a third of what it is today. That's the goal over time. But there's always cool stuff. You can chase your tail with all the new stuff. And you're in the space, you know that. It's, oh my gosh, there's so much stuff. I would say 99% of stuff does not make it through our filter.
I appreciate that because, as you said, you have clinics with licensed practitioners that want to keep their licenses going. And you don't want to be so at the cutting edge that you are throwing out things that haven't been proven or tested.
Mhm.
But how cool is the idea of oil change for your body at
Oh,
least
man,
once a
it's
year,
awesome.
right?
It's
I
awesome.
love that idea. Who wouldn't want that, especially once
Yeah.
you're older? We all want to have more energy, better brain function. We all want to have better metabolic health and better immune system. So if you can obviously improve quality of your blood, which is
Yeah.
that connects everything, communicates to all the tissues in the body. That is such a great tool to reverse that aging clock a little bit and improve the quality of your life.
We think the body has an amazing ability to heal itself. And I think you just got to get the things out of the way of the body and let it do its job. Getting heavy metals and plastics out of your body will help your body function better. A lot of times, stem cells, your body has stem cells. Over time, you produce fewer stem cells in your joints and all of that. So if your body had more stem cells and more exosomes and all of that, it can do what it needs to do. But for a variety of reasons, when we're aging, those things integrate. Like when we're doing hormone replacement therapy, we're putting in your body the thing that your body uses to make you better. So we're just making sure the body has what it needs, or the body has things removed from it that are keeping it from doing its job. That's why I say I always want to start with as natural a thing as possible. to help somebody be better. There are definitely times for medications, but that is not where I think you start. And the other principle I'd say is we always start at the lowest, the minimally invasive thing first. When people come to me, oh, my shoulder's been bad for 10 years, I got to get a surgery. So hold on. Have you tried this? Have you tried this? Until you've tried those things like shockwave therapy, stem cell injection, what are you doing talking about a surgery? Now, there's a time and a place for everything, but start with these other things before you go all the way to the most dramatic thing. I would say if you ask a surgeon what he should do, he's going to say surgery. That is their job. There are, of course, surgeons who will say, hold on, you can try other things. But for the most part, if you go to a surgeon, you're going to get surgery. If you go to a landscaper, you're going to get a landscape plan. If you go to, what do you expect? So we do try to do the minimally. I'd much rather someone try shockwave therapy on a joint, even before stem cells. And I love stem cells. You'll get to stem cells and then you'll get to surgery if you need it. But let's try some other stuff first.
And that's what it's about, reimagining healthcare to be more preventative and start with the least invasive things, lifestyle changes, supplements, some of these adjunct therapies that are not
Yeah.
invasive, like you mentioned, maybe peptides or shockwave therapy,
Yeah.
red light or hyperbaric,
All of it.
all these kind of things. Now, for women that are listening, navigating midlife health, what does better access to health optimization medicine practically mean? So once these clinics open up in their neighborhood, what is that going to mean to a 40-year-old mom who's walking into your clinic?
Be skeptical of some of the options that are out there. I see many OBGYN practices. I see many women going to their primary care doctors. I am appalled by some of the stuff. So the first thing I'd say to women is have some agency and be critical and skeptical in a healthy way of who you are talking to. If they can't convince you that they really understand what they need to understand, then go somewhere else. There are better options. So I think that's the good news. There are better options today. And so Humanot, I think, is a great option for women. And it's because we do have the right leaders. It's because we take this holistic approach. It's because we look at your ecosystem and all that. But everyone doesn't have access to Humanot yet. There will be a day when everyone will. Try to find your North Star. And if you aren't going to someone that has the things you think are important, find someone else. Women settle way too often. She's my OBGYN. She must know. Don't assume that. Ask around, try a few places. And if they can't tell you about movement and nutrition and other things, go find someone that can. And what happened is, you know this very well, the Women's Health Initiative set back women's health and hormones for women a decade or two. And there are still many doctors out there that question whether hormones are really good for you and do they cause cancer and all of these things. It's ludicrous. Number one, if you get a doctor that still questions any of that because the Women's Health Initiative, run out of the clinic, go find someone else. If you talk to a doctor that is not able to talk to you more holistically of, hey, we can do hormones, but these other things are important as well, I'd also say run, go find somebody else. But women have great options. My wife, I love my wife dearly. We've been married for 20 years. I'm so happy. She went through menopause a couple of years ago. I could get a little emotional about it because my wife looked at me and she said, I'm dead inside. I love you. I know we need to do certain things. I know we have to have a physical relationship, but I am dead inside. And I need to go fix this. And it took multiple people, multiple options before she finally got it right. And until she got it right, it was horrible. And a lot of people will reduce it to sex because that's the obvious manifestation of it. But she's like, I know we have to have a physical relationship, but okay, no problem. I'll do it anyway. And I was like, hold on. I'm not a caveman. No, I want you to be healthy and in a place where you enjoy these things because otherwise this doesn't work. And so I was really glad to be a part of her journey and see her fix it. But it took her going to more than one person. It took her walking out of a couple of places. And now she's in a very good place. I'm super happy about it. I'm also quick to tell women don't reduce it to things like just sexual health. It's brain health, it's heart health, it's energy, it's all this other stuff. Why would you want to go through life without being optimized from a hormone perspective? Because it does so much for you.
I really love what you said about treating the whole couple, husband and wife, at the same
Yeah.
time, because that's how you address it holistically. That relationship really shifts in midlife to keep it going, keep it alive and energetic, to enjoy that stage of life. We want to have the energy, not just the sexual health, as you said, but energy during the
Yeah.
daytime, having the same brain function, hormonal optimization, and everything else we do. I think the number one reason women take action is not for sexual health, but for brain fog, lack of
Yeah.
energy, and metabolic health. I think
Yeah.
for men, sexual health is a higher motivator.
Yeah.
For women, it's like energy, brain fog, just being able to
Yeah.
function at a higher level because you miss out on life. We work so hard to get to the point that we hit our 50s. We want to be able to enjoy that next
Yeah.
stage of life. We still want to be able to travel, spend time on things, our hobbies. Maybe we now have more time, but you also have to have the energy and vitality to do
Yeah.
those things.
I 100% agree with you. And you're right. I think men tend to come at things from their perspective and women. And by the way, I don't want to put all men are coming at it from a sexual health and all women are not. I think a practice has to recognize that people come at their problems for different reasons and have different motivations. It's important to find that starting point. When you unlock hormone health for a man and a woman, they might have come at it for a specific reason, but then it unlocks so many other things. What a shame to get to your 50s when you are at theoretically the height of your powers. Now have more time because the kids are gone. You have more wisdom, you have more financial resources to not then be able to go and really enjoy life for the next 25, 30, 40 years. What a crime that would be. And that's why we talk about our mission. Our mission is to add 20 good years of living to our clients' lives. But the submission is because if we do that, we have a huge impact on society because the 20 years that we add that are good years, once again, when people are at the height of their powers, they are more wise, they are more connected, they have more resources. And so if you can energetically lean into it at that point of your life, that's way better than 25-year-olds leaning into solving the world's problems. We do think of this in this bigger way. The last thing I say to people is, hey, take care of yourself, get healthy, then get the people in your life that are important to you healthy as well. What good is it if you're healthy and your spouse isn't healthy, your best friends aren't healthy, and all that? Be the beacon that kind of sends the signal out to everyone around you that you care about. Hey, look at me. Like we can all be better. And that kind of gets to the connectedness and community, which I also think is a big part of health and wellness.
What a perfect place to finish up. I would love to hear how can our listeners find your clinics? Tell us about your website. How can we follow you and your leadership?
Yeah, so obviously go to humanothealth.com. You can find the website there. We are in Austin. We just opened a clinic in South Florida. We've got one in Dallas under construction. We've got several that we're working on in the New York City area, Southern California, and other parts of the country. By 2030, we want to have 100 clinics open around the country so we can be close to everybody.
Jim Donnelly, thank you so much for your time.
No, thank you. I love what you're doing. I love your approach to things. Like I said, you are an amazing spokesperson for women and women's health, and I really appreciate you having.
Thank you so much for tuning in. This is Maya. Our production team pours our hearts into this show because we believe women deserve better. Better conversations, better tools and health strategies that are actually built for our physiology. But here's the truth. This show doesn't grow on its own. It grows because you share it. So if this episode hit home, do me a favor, follow the show, leave a quick review, and text it to a girlfriend who needs to hear this. And if you want to go deeper or connect with other women on this path, come join our free community at optimizedwomen.com. Thank you for being here. We appreciate you more than you know. The views expressed on this podcast are solely those of the speakers and do not reflect the host's opinions. The content is for informational purposes only and is not a substitute for medical or nutritional advice. Always consult a licensed healthcare provider.